focus a lot on manual therapy. So what is that?
Manual therapy is exactly as it sounds. It's hands-on therapy, and it consists primarily of mobilization of the soft tissues of the body, like muscles, connective tissue, fascia, ligaments, tendons, and then also joint mobilization, where we move the joints in the body to make sure that they have all the movements that they need for you to move your spine and your limbs around. And we use manual therapy when we find that there's a movement dysfunction where either certain soft tissues might be a little bit too tight to allow the body to move normally, so we use that manual therapy to mobilize and allow those soft tissues to adaptively lengthen to promote normal movement. Or maybe joints are not moving as they should, maybe they're moving a little bit too much in one direction, not enough in another direction, so we mobilize them accordingly to again restore their normal movement pattern.
Okay, so to follow up on that, now for female dancers that experience back pain, how can manipulating the spine help them with better movement and pain relief? And I've actually heard that there are more than 100 different adjustment techniques. Is that correct?
I would say at least that much, yes.
Okay.
So manipulating the spine can be a healthy part of treatment for different dance-related injuries or even non-dance-related injuries. It would have to be a problem where there's some sort of movement restriction in the spine. And we would determine, is that movement restriction caused from a neuromuscular problem, meaning are there muscles that are too tense that need to be kind of released in order for that spinal joint to move normally, or is it more what we would call an articular problem, a joint problem? And if it is an articular restriction, sometimes mobilizing or manipulating that particular movement restriction can promote more normal joint and more normal movement patterning.